So let's go over the temporalis muscle. We're going to go over a little anatomy, and then I'm going to show you how to treat this very, very important muscle. So let's go over the anatomy of the temporalis muscle. First, I'm going to move the master out of the way here. And if we look at the origin of the temporalis muscle, we'll see all along here how the fibers actually go right into this area here, and we're on the temporal fossa. And basically, it also inserts into the temporal fascia, and superior to the zygomatic arch here. If we look at the insertion of the temporalis here, we'll just kind of move it out of the way here. We'll get onto the coronoid process here. And it also inserts into the anterior border of the ramus of the mandible. It's a really interesting muscle. We start getting into palpation. We're going to have to actually go along the inside of the jaw here, superior teeth, and we can actually get onto some of the fascia, because as soon as we start tractioning around this area, we're going to have influence farther up the muscle itself. But as we go through palpation and treatment, you're really going to see how creating tension in one area affects a larger region. So let's get on to palpation. So first we'll start out with the external areas of the temporalis. So Mickey, I'm going to get you to just clench your jaw there. Right, and let it go. You can feel that tighten right up there, can't you?
Yep.
Okay, one more time. And out. Okay, good. Again, it's pretty amazing because I'm pretty far up here. You can actually feel expansion of the temporalis as you clench your jaw together. Just one more time. Good. So when I'm on there, I'm going to do a little bit of cross friction until I maybe find a tender point in there. Feel that right there?
Yeah, I was just, yep.
Yeah, you can feel like there's a fibrous band in there and it feels pretty tight. So what you do is actually palpate all around the fossa, get on the temporalis, move down actually towards the coronoid process. And once you've actually located some tight areas, feel free to get in there and kind of massage the area around a bit. You okay?
Oh, yeah.
Okay, good. And then after you loosen it up a little bit with just a little bit cross fiber in there, not too hard though, realize that this can be a very painful area. If you find a trigger point, then this area could actually increase a headache or just be really, really painful. You're not having a headache, are you?
No, not at all.
Good. Okay, so just to do a little bit of pin and stretch on this, I'm going to get you to open your mouth there wide. Good. And release. So go slow with this. Okay. Open again. How's that feeling?
Oh, good.
Okay. And release. Okay, I'm just going to use the palm of my hands here a little bit too. Open again. How's that feel? And release. It's nice to have that broad contact on there. Bilateral, so you can get in there. Again, good. One more time. And release. Okay, I'm just going to bring it down a little bit now. Open wide. Good. And release. And again. And release. Okay, so let's move on to the internal portion of palpation and treatment. So let's go over the internal aspect of the temporalis muscle. Mickey, I'm going to get you to open your mouth here, please. And just turn a little bit this way. Good. Okay, so what I'm going to do is I'm actually going to go across the upper teeth here, all the way down onto the coronoid process. You okay there?
Oh, yeah.
Wonderful, eh? So I'm going to go on the temporalis on the side here and open just slightly, close a little bit. No, not that much. Open there. So I'm going to pull here. So I'm tractioning both of my thumbs like this. Can you feel that tension in between there? Mm-hmm. Okay, do you feel like on the coronoid process, the inside there? I'm going to get the camera to just come in a little bit there. Okay, so when I'm pulling, what I want you to see is if I'm pulling up here in the temporalis, do you feel it right on the coronoid process inside your mouth?
Yeah.
And that's the key issue here. You want to feel that traction in there. Now, if we think of the anatomy of the temporalis, just come out for a sec there with the camera and go up on the top here, showing this area up here. If we go and kind of pull in the different areas there, okay, are you still feeling that tension up there?
Yeah.
Still feeling the tension there?
Oh.
Okay. So it's like we're making our way around all the fibers here, and you can still feel the tension there. So you basically take it and pull. 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 Okay. Now, what's really important is make sure that even if you have one side that's symptomatic, you actually treat both sides. It's so important that we don't actually create a problem by only releasing one side. So I just want to mention some of the fascial connections and how it actually relates to acupuncture. If we look at the occipital frontalis muscle from the base of the suboccipitals going underneath the hair right to the front here of the frontalis, it's covered by fascia or connective tissue. That fascia is continuous with the fascia that surrounds the temporalis muscle. And if we actually get on a certain area here and go up from the corner of the head, in acupuncture we have a point what they call 5 chun, which is about half the size of my thumb up from the forehead here. In that area there, we will get a little point here called stomach 8, Tao Wei. You feeling that, Mickey, right there? Mm-hmm. Okay. Now, it's interesting because if you actually stimulate this point, it can have effects on not just headaches, but on if your eyes are lacrimating, producing a lot of liquid. It can affect a number of things in terms of tension headaches, other problems there. So you just get in and kind of rub the area there. Is that sensitive or?
It's not sensitive. It was when you first kind of.
Yeah, and it kind of released right away because I don't think it's a point. Now, here's a really important point. If you actually get on an area where there's fascia and there's an acupuncture point, these are also areas where you have high neurological input. So there's a huge correlation between the density of neurological input in an area and where the acupuncture points are located. So in conjunction with actually doing the hands-on manual therapy, I would highly recommend stimulating this point if a person is having a lot of tension throughout the temporalis muscle.